Hello, I am Dr. Chandrika, practicing as an obstetrician and gynecologist at Chirag Hospital, P Nagar 2nd Phase, Bangalore. I also do visit Malati Manipal Hospital, Jayanagar 9th block, Apollo Cradle Hospital, Jayanagar 5th block. I do visit Motherhood Hospital at Banashankari 2nd stage. Coming to pregnancy and fetal movements count. See, fetal movements counting is a particular part of pregnancy when the fetus starts moving. See, that is what is called as quickening. When you start appreciating the fetal movements, that particular symptom is called as quickening. Usually this happens after the 5th month of pregnancy. And these ladies, they'll first time pregnant ladies not have so much experience about this. So many patients, they'll be so worried. They'll tell, I have not at all felt the fetal movements, because there is a wrong concept among these people that they'll think that actually as soon as they become pregnant, they'll be able to sense the pregnancy. That is not true. The fetus has to grow to a certain extent, after which only they'll be able to make out the movements of the fetus. That is one important thing that the public have to realize. So the fetal movements will start only after the 5th month of pregnancy. That also, so many patients will not sense it even after 7 months. So that is, so many times they come to us complaining that they are not able to feel the fetal movements. So we have to show them in the scan, this is the movement and what did you feel now. So we have to explain to them how the fetal movements will be, then they will be able to understand the fetal movements. So how to count these fetal movements? One of the ways of knowing the fetal well-being is counting of the fetal movements by the mother. This can happen in the house only. For that, they need not go to the hospital or to the doctor. So they have to know how much counts the baby does and all that. So one most important thing I'll tell you is this fetal movements count is, I don't tell much about this because it will cause more stress for the patients. See, fetal movements, it will be different in different individuals. See, some people are very obese and by nature they are not sensitive enough. So they may not be able to sense the fetal movements, when in other sensitive patients who can recognize it is more easily. What I have observed is more thinner patients more appreciate the fetal movements more better. So when you come to fetal movements count cannot happen whole day. So many ladies are so busy over the time of the day. Most of them are working ladies. So whole day they are very busy with their profession or their work. So in the time when they are busy with their work, they will never notice the fetal movements. And last part of the day when they come home, then they go to bed, they start taking rest. That is the time they are able to have time to concentrate on recognizing the fetal movements. So that is the reason when you want to count the fetal movements, first you have to relax, then concentrate on your abdomen and try to appreciate the fetal movements. That is the first point. Second thing is how many movements happen in what number of duration. Commonly what happens is roughly about 8 to 10 movements can happen in 1 hour. What I tell my patients is, if there is less than 8 to 10 movements, don't get panicky. So just try to concentrate more on that, try to relax more and observe that one. I try to tell them to meditate on your fetus. So that is the way that you can try to appreciate your fetal movements, and the fetal movement counts happens like that. So that is the rough method of counting the fetal movements. That is about 8 to 10 counts per hour, and it is not mandatory for all patients to have the same thing. So when there is some problem with the pregnancy, then the obstetrician tells the patient to try to go home and keep counting the fetal movements, so that if there is no fetal movements at all, they have to know before something can be done. So if it is too late, we cannot do anything. So if just the fetal movements have stopped, if you recognize immediately, we can somehow sustain the baby, can immediately remove the baby and the baby will be allowed to live a live life. So that is the reason fetal movements counts are told to be important in pregnancy.